today everybody's saying, well, we're in support of you. What can we do? So this is what we're telling them today, then what they can do, because ONA has set up the website ona.org/PRHC where they can go online. We're giving out pamphlets, postcards today that they mail to Premier Dalton McGuinty and sign about threatening to cut the healthcare system. So everyone is supportive. We haven't had one person that isn't supportive.
This hospital serves a wide area. There are people coming from, long distances away, and for some of them to drive as long as they do and then have to have long waiting periods out in a hall or in a waiting room, that's just not good. And particularly when they're elderly. And as we get elderly, we know about that.
We need to be vocal. We need to protect healthcare that we have here in Ontario. We don't want to see the deterioration of our healthcare system because it's not good for them.
They're also just passed legislation which is going to start awarding funding to people who offer the lowest cost services. So if we, for example, and this is just an example, if we charge maybe $1,500 for a CAT scan here in Peterborough and Scarborough charges $1,200, they're saying, well, we'll fund them. So that would mean that people in Peterborough, and our catchment area is up to Apsley, Bancroft, Peterborough, Coburg, shucks, you don't get funding for that, they got to drive there. It reduces local services even further. And if you're already sick or injured and out of money and not able to look after yourself, let alone do you have a vehicle or means of transportation to get there and spend the whole day getting services, it's very frightening.
The main problem with cutting nurses would be the affected health care. They say that it's not going to be affected, but I don't see how that would be avoided.
We'd like to represent the patients that we take care of. We feel the cuts that's happening to Peterborough Regional, the 121 proposed full-time nurses that they want to cut, 71 beds, is huge impact to our patients. We already have a huge wait list in our emerge departments of people sitting in hallways, waiting on stretchers, waiting for health care, and there's no nurses there to take care of them as it is.